There's a crucial molecule in your body that helps control everything. Your circulation, your energy, your stamina, your heart, even your sharpness of mind. It's called nitric oxide. But after age 40, your body makes less and less of it. Less blood flow, less stamina, less of you. But now there's N101, the nitric oxide lozenge developed by Dr. Nathan Bryan, the world's leading nitric oxide researcher backed by Nobel Prize-winning science. N101 is designed to naturally restore your body's nitric oxide levels. Just do what I do and let one dissolve in your mouth twice a day. I especially make sure to take it before workouts. N101 goes to work in minutes, releasing nitric oxide directly into your bloodstream, supporting healthy circulation, boosting oxygen delivery to your muscles and brain, helping you feel the way you're supposed to feel. More energy, better blood flow, sharper focus. Day after day. N101, it's the science of you working better. Visit HoffmanNO.com. That's HoffmanNO.com and use coupon code Hoffman10 for 10% off N101.
Welcome to Leyla Weighs In. I'm your host, Leyla Muedin. On this Intelligent Medicine podcast, where I weigh in every week. These podcasts usually drop on a Friday at the drhoffman.com website, so you can go there to download them. If you'd like to email me with questions, topics of interest, that email is questions@drhoffman.net. That is questions@drhoffman.net. So let's talk about our joints, our joint health. What causes joint inflammation? How do we get rid of it? Joint inflammation can occur due to a wide variety of causes. But the good news is that it can be minimized in a whole lot of ways. So inflammation of the joints is one of the most common reasons people experience pain, stiffness, or they have trouble moving. And it can affect almost any joint in the body, whether it's the knees, the hips, fingers, shoulders, ankles, and spine. Now, for some people, the problem appears suddenly after an injury. And for others, it develops slowly because of arthritis or an autoimmune disease or long-term wear and tear. You know, it could be an occupational hazard if you're doing a lot of manual labor, which requires you to use those muscles and joints a whole lot, right? Or you're an athlete, you're an elite athlete. That can happen. So, if you've ever wondered why my joints are swollen and painful, or how can I get rid of joint inflammation fast, besides popping an Advil or a Tylenol or something like that, and, that's a short-term fix. It takes care of your pain and your discomfort, but it's not something to rely upon because that is not the cause of your joint pain. Your joints being swollen and painful is a symptom of something else. And why is your body doing that? So understanding the root cause is the first step toward finding the right treatment. So what is joint inflammation? It happens when the tissues around a joint become irritated or damaged. The body responds by sending extra blood flow, fluid, and immune cells to the area. While this response is designed to protect and heal the body, it's an uncomfortable symptom. You feel more heat, maybe you feel swelling. The immune cells add to the swelling and discomfort, but this is what your body is doing in order to protect and heal your body. So the remedy is actually the symptoms, the discomfort you're experiencing. That is actually the body's remedy. So common signs include swelling around the joint, pain or tenderness, redness and warmth, stiffness, especially in the morning, unless you're sleeping on a not so good mattress or pillow for you, that'll cause you to be stiff too. So stiffness, especially in the morning, reduced range of motion, and a feeling that the joint is tight. The joint feels tight or difficult to move. Now, inflammation may affect only one joint, like a swollen knee after an injury, or several joints at the same time, as in rheumatoid arthritis, which is an autoimmune disease. Joint inflammation is not a disease by itself. Instead, it is usually a symptom of another condition. Here are the most common causes. Number one, arthritis. It is the leading cause of joint inflammation. There are more than 100 different types of arthritis, but a few are especially common. Osteoarthritis. Osteoarthritis is often called wear and tear arthritis. It develops when the protective cartilage that cushions the ends of the bones gradually wears away. And without enough cartilage, the bones rub together, causing pain, stiffness, and swelling. Right? You've heard of bone on bone, especially in the knees. The hips can be affected, the hands, the lower back, the neck, and it's more common in adults over 45 years of age, and it tends to worsen with age, with excess weight, or previous injuries. You know, if you've been in a car accident and you have arthritis due to a car accident, that's that. It's not something that naturally evolved in your body with your age or with excess weight or some other condition that's going on. Let's talk about rheumatoid arthritis. That's an autoimmune disease. And this means the immune system mistakenly attacks the linings of the joints, known as the synovium. And as the lining becomes inflamed, the joint swells, and then, of course, it becomes painful. And unlike osteoarthritis, rheumatoid arthritis often affects the same joints on both sides of the body. For example, both wrists or both knees may become swollen. The common symptoms include morning stiffness lasting longer than 30 minutes. It's not a matter of, you got a little tight overnight and now you need to go walk around, loosen up, get your blood circulating. This is a stiffness in the morning that lasts longer than 30 minutes. Swollen fingers, hands, or knees, fatigue, low-grade fever. So these are all associated with rheumatoid arthritis. Let's talk about gout. Gout is another common cause of joint inflammation. It occurs when too much uric acid builds up in the body and forms sharp crystals inside a joint. A gout attack often comes on suddenly and may cause severe pain, swelling, redness, and heat in the affected joint. The big toe is the most common place for gout. So those of you who have had gout, you know all about this. But it could also affect the ankle, the knee, the wrist, or the elbow. Let's talk about psoriatic arthritis. People with psoriasis, a skin condition that causes flaky patches. Psoriasis is an autoimmune disease where your skin, the production of skin cells goes into overdrive, causing this psoriasis, which is like flaky patches. Folks with psoriasis may also develop psoriatic arthritis. Now, this form of arthritis can make the fingers and toes swell and may affect the lower back, knees, or ankles. Joint injuries, a sprain, a fracture, a torn ligament, or sports injury can cause joint inflammation. After an injury, the body sends fluid and immune cells to the area to begin the healing process. And this is why an injured joint often becomes swollen, warm, tender, and difficult to move. So, common injuries linked to inflammation include twisting your ankle, maybe a knee ligament injury, shoulder strain, and repetitive stress injuries. If the injury does not heal properly, the inflammation may become chronic and continue for weeks or months. And then autoimmune diseases. Some autoimmune diseases can attack the joints and cause widespread inflammation. Examples include lupus, ankylosing spondylitis, psoriatic disease like in psoriasis and psoriatic arthritis, and Sjogren's syndrome. Sjogren's, where the immune system is attacking, the salivary glands and the tear glands and, drying us up. That includes in the bowel as well. That's what Sjogren's syndrome does. In these conditions, the immune system becomes overactive and attacks healthy tissue. Unlike an injury, which usually affects one area, autoimmune diseases may cause inflammation in several joints at once. Now, people with autoimmune-related joint inflammation may also notice these symptoms: extreme fatigue, fever, skin rashes, muscle aches, dry eyes, or dry mouth. A joint can sometimes become infected by bacteria, virus, or fungi, and this is known as septic arthritis. Joint infections are serious, and they require immediate medical treatment because they can quickly damage cartilage and bone. So symptoms of an infected joint include sudden severe pain, major swelling, redness and heat, fever, difficulty moving the joint. The knee is the most commonly infected joint, although infections can also affect the hip, the shoulder, or the ankle. So if you have swollen, painful joint, along with fever, you want to contact your doctor immediately. It could be septic arthritis. It may also be rheumatoid arthritis, all of these. So let's talk about tendonitis and bursitis, because sometimes the inflammation is not actually inside the joint, but in the tissues that surround it. Tendonitis. This often occurs when a tendon becomes irritated from overuse. Tendons connect muscles to bones. Repetitive motions like lifting or typing, running, or playing sports can lead to inflammation. Bursitis affects the bursa, which are small, fluid-filled sacs that cushion the joints. Repeated pressure or movement can make these sacs swollen and painful. So both tendonitis and bursitis are common in the shoulder, in the elbow, in the hip, and in the knee. So, what are the lifestyle factors that make joint inflammation worse? Even when an underlying condition is present, certain lifestyle habits can make the inflammation worse. It can exacerbate the condition. Excess weight, being overweight, places extra pressure on the joints. It does. You're hauling around more weight than it should be, than you should be. And especially around the knees, the hips, the ankles. Carrying additional body weight can also increase inflammation throughout the body. Poor diet, a diet high in processed foods, sugar, deep fried foods, refined carbohydrates, may worsen inflammation. Absolutely. A poor diet will do that. Now, a poor diet also includes if you have food allergies and you're not paying attention or eliminating them, that could cause pain in your joints. If you have candida, I know several people, I could tell you several case studies where after being on a candida diet and everything, all the symptoms go away, they might then cheat and have, say, a pastry or something, or a cup of coffee with sugar in it, and immediately they might feel a pain in their hip, their shoulder, ankles, anything like that. So, a poor diet, but also not eliminating the foods you're allergic to. All right? This is important. And by the way, if you have a systemic arthritis or rheumatoid arthritis, osteoarthritis, actually any of these, eliminate the nightshade family of foods. These include tomatoes, white potatoes, peppers, including paprika and cayenne, eggplant, and tobacco. These are the nightshades, and you should eliminate them. You may find relief, but you want to eliminate them for a minimum of 2 to 3 months in order to feel a difference. When it comes to arthritis pain from gout, what really causes uric acid to be high is not the purines in your foods as much, but insulin resistance, metabolic syndrome. High insulin will cause high uric acid and will cause gout. So you need to lay off the sugar, the refined carbs, lose that excess weight, all of the above. Brings down the blood sugar, brings down the insulin, and finally brings down the uric acid. What else causes, can make joint inflammation worse? A lack of exercise. When you don't move enough, the muscles around the joints, they become weaker. Weak muscles provide less support, which can lead to more pain and stiffness. If you don't use it, you lose it, right? You want to keep the joint supple. You want to move your muscles. You want to exercise, all of that, your body. Good for the circulation. Smoking can worsen inflammatory diseases like rheumatoid arthritis, and tobacco, that's also a nightshade, FYI, right? Chronic stress may also increase inflammation by affecting the immune system. So how to get rid of joint inflammation? The best treatment depends on what is causing the inflammation. However, several methods can help reduce pain and swelling. You want to rest the joint. If a joint is inflamed, you want to give it time to recover. If you're athletic, you need to take a time out. It could be weeks, maybe a couple of months for you to recover. You need to do that. And you want to avoid activities that make the pain worse. For example, if your knee is swollen, try limiting running or heavy lifting for a few days. Using a brace, a wrap, or support can also help protect the joint while it heals. Apply ice or heat. Ice and heat can both help, but they're used in different situations. Use ice for new injuries or sudden swelling, and use heat for stiffness and long-term inflammation. You want more circulation in that area, right? Apply an ice pack or heating pad for 15 to 20 minutes at a time. And certainly you could take over-the-counter anti-inflammatory medicines like ibuprofen, that's your Advil and your Motrin, naproxen, which is your Aleve, and certainly aspirin. These medicines help to reduce pain and swelling. For more severe inflammation, your doctor may prescribe a stronger medication or even recommend corticosteroid injections, cortisone shots, right? So, you need to proceed accordingly. You want to exercise gently. It may seem strange, but the right kind of movement can actually improve joint inflammation. Low-impact exercises help keep the joint flexible and strengthen the surrounding muscles. Those surrounding muscles need to be strong so they could support the joint. That's how you keep your joints healthy too. What are some exercises? Walking, swimming, stretching, yoga, cycling. And you want to avoid high-impact activities if they increase pain. You want to eat more anti-inflammatory foods that may help reduce joint swelling over time. Fatty fish like salmon and sardines, or take an omega-3 supplement. Leafy greens, berries, turmeric, and ginger. And again, stay away from the sugary drinks, the fast food, the processed snacks, certainly excess alcohol. And lose weight if needed. Even a small amount of weight loss can reduce pressure on the joints. Research shows that losing 10 pounds can significantly reduce stress on the knees. This is especially helpful for people with osteoarthritis in the hips or knees. You want to treat the underlying cause, because remember, temporary remedies may help for a while, but long-term relief comes from treating the underlying problem. For example, arthritis may require medication or physical therapy. Gout may improve with, getting off the sugar and the carbohydrates, even lowering uric purine-containing foods just for a little while in the beginning. Autoimmune diseases, you want to be able to treat that, whether it's with immunosuppressant treatment or ridding yourself of gluten and casein. Now, when it comes to infections, that often requires antibiotics. So other helpful joint-supporting supplements are things like glucosamine sulfate, chondroitin, to support cartilage repair and joint cushioning, MSM and bromelain to help reduce stiffness, improve flexibility, turmeric and Boswellia to support healthy inflammatory response. Quercetin is a great antioxidant for antioxidant support. This is all good. So remember all of these. Take care of your joints. Remember that it can occur due to a wide variety of causes, and you need to find out the underlying reason. And this is from worldhealth.net. What causes joint inflammation and how to get rid of it. I want to thank you for joining me on another edition of Leyla Weighs In. This is Intelligent Medicine.
I want to thank you for listening to the Intelligent Medicine Podcast. Follow us on Apple Podcasts, Spotify, Amazon Music, or your favorite podcast app, and get new episodes automatically downloaded every weekday. And please give us a rating and review. It truly helps new people discover intelligent medicine. The Intelligent Medicine Podcast is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The use of information on this podcast or materials linked from this podcast is at the user's own risk. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions. Finally, please visit drhoffman.com and discover everything Intelligent Medicine has to offer, including frequently updated, unbiased health news and fully vetted product and supplement recommendations.
This is Leyla Muedin, registered dietitian nutritionist. I maintain a private practice and see patients regularly. If you require a nutrition consult with me but live out of town, There's no need to travel to New York City. I have telephone and telehealth consultations with clients from all over the country. Please visit drhoffman.com for more information. And to set up an appointment, call 212-779-1744. That's 212-779-1744. I look forward to being a collaborator in your healthcare.